This is Pack 365. Myself Srija. So today we are going to learn about the continuation of General ICD coding guidelines. So coming to documentation by clinicians other than the patient's provider. So what does it mean? Usually coding is based on the documentation, right? So the documentation is done from the patient's main provider. So that is a physician or qualified healthcare professional who is legally responsible for the diagnosis. So sometimes codes can be assigned based on their other clinicians' notes. If these clinicians are authorized to record the information in the patient's official medical record, so their documentation is allowed by the hospital policies or the regulatory rules. So in simple terms, normally coders uses the doctor's documentation for diagnosis coding, right? So but if a nurse, therapist or other professional is legally allowed to document, so their notes can also be used for coding. So as long as it's permitted by the hospital or law. So this is about the documentation by clinicians. So when other clinicians' documentation can be used. So what are the expectations? Normally, only the patient's main provider can document the diagnosis for coding. However, there are some expectations or exceptions when information can be taken from other healthcare professionals. So what are the exceptions? So these types include BMI, the body mass index, depth of non-pressure chronic ulcers, pressure ulcer stage, coma scale, NIHSS, SDOH, and also the laterality, like right, left, bilateral, and also the blood alcohol level and the immunization status. So who can document these? Other clinicians which are involved in the patient care. For example, a dietitian can record the BMI. A nurse can document the pressure ulcer stage. So an EMT can record the coma scale. So what is the important rule over here? While these measurements or the findings can be documented by the others, so they can always be documented by the patient's provider. If there is a conflict information between the clinician's notes, the provider should be asked to clarify. So what are BMI, coma scale, NIHS and blood alcohol level and SDOH codes? So these types of codes are not primary diagnosis. So these type of codes are secondary. They are only reported as a secondary diagnosis, meaning they support or they add the details to the main diagnosis, but they never coded as the primary one. So coming to syndromes. So what is syndromes? It's a group of symptoms that occur together, right? So what is the meaning of syndrome? A group of symptoms that occur together. So how to code syndromes? You have to follow the alphabetical index in the ICD-10 book. Then if no specific code exists, you should code the individual symptoms or manifestations that are documented. So if the syndrome includes additional unrelated symptoms, then you have to assign the extra codes for those two. For example, if there is a Marfan syndrome, which is coded, but the patient also has a heart issue, which is not directly related to the part of the syndrome. So what you have to do, you can add a separate code for that heart condition. Means you have to code for this Marfan syndrome and you can add a separate code for that heart issue. So this is about the syndrome note. So what do you mean by the documentation of complications of care? So what is complication? Complication is nothing but it's a condition, right? It's a condition caused by medical care or surgery. So you can code a complication only if the provider clearly documents that the condition is related to the treatment or the procedure. Not every issue after a surgery counts as a complication. Only if the provider confirms it. It is only considered as a complication. For example, if a patient develops an infection after surgery and the provider states it's due to the surgery, then it is coded as a complication. But the provider doesn't state it is due to surgery. If there is no link is stated over there, then there is no need of coding it as a complication. So this is the important rule of the complication, how to code a complication. So there are some cause and effect relationship between the complications of care. So what is cause and effect relationship? There must be a clear connection between the medical care or surgery and the condition that occurred. If the documentation must show that the condition is clinically significant, that is, it is affected the patient's care or recovery. The provider does not have to use the exact word complication, but as long as the link is clear from the notes. For example, if a condition changes the course of surgery, that is unexpected bleeding that affects the operation, then it is appropriate to report a complication code. So when you have a doubt, you need to clarify. If it's unclear whether the condition was caused by the procedure or not, then you always have to ask the or query the provider for clarification. So before coding it as a complication. So a complication code should be used only when the condition is directly caused by the medical care or the surgery and it has a significant effect on the patient's treatment. So next one is borderline diagnosis. So what do you mean by borderline diagnosis? Means it is a confirmed diagnosis. So if the provider writes borderline diagnosis at discharge, it is coded as a confirmed diagnosis unless ICD-10 has a specific code for that condition. For example, borderline diabetes. So use a specific ICD-10 code for it. When borderline is not an uncertain diagnosis. So there is no difference between inpatient and outpatient settings. It's coded the same way. So if the record is not clear whether the condition is truly borderline or uncertain, then you have to query the provider for clarification before the coding. So how do you use the sign, symptom and unspecified codes? So sometimes a provider may not have enough information to give a specific diagnosis. In such cases, it's okay and it's even necessary to use the sign, symptom codes, unspecified codes, and also whenever the exact cause isn't known, you have to code the unspecified. So what does these codes are used, how they are used? They are used only when they best describe the patient's current condition and the documentation doesn't allow for a more specific diagnosis. So borderline means it's a treat as confirmed, and unspecified or symptom code used only when the provider documentation doesn't give you enough detail for a more specific code or a precise code. So this is about the borderline and use of sign, symptom and unspecified codes. So coding each healthcare encounter. So how do you code each healthcare encounter? So every patient visit is called as an encounter, right? So this encounter, it must be coded based on the level of certainty that is known for that visit. So only code what is confirmed or clearly documented. You should not assume, you should not guess any codes unless and until it is confirmed. So there must be a teamwork between the provider and coder. So what does it helps? It helps in accurate coding. So this accurate coding, it depends on good communication between the healthcare provider. What's here? What do you mean by healthcare provider? The provider who gives the treatment. For example, doctor, nurse, etc. So there must be a good communication between the doctor and the coder. So they both must work together to make sure the documentation is complete. All the details are included or not. And also they must make sure it is accurate, all the facts are correct or not, and they must also make sure whether it is consistent or inconsistent, whether it matches across all the reports or not. So what is the importance of the documentation actually? It is more important, right? Because if it's incomplete or unclear, there will be no correct coding possible. So the correct coding is possible only when the documentation is complete and clear. So the entire medical record must be reviewed to understand first what is the reason for encounter and how the conditions are treated So what treatment have been given. So this is the main importance of the documentation and the healthcare encounter. So definitive diagnosis. So what happened when a definitive diagnosis is not known? So sometimes by the end of a visit or encounter, the doctor may not know the exact diagnosis. In that case, it's okay to code for the signs or symptoms like cough, fever, etc. instead of the final diagnosis. So how to use of the unspecified code? So if the doctor knows something about the condition but not enough for a specific code, so you can use an unspecified code. For example, when the doctor knows the patient has pneumonia but not what type, so code unspecified pneumonia. So when to use these unspecified codes? Use them only when they best describe what is known about the patient's condition at that time. So they show the provider has documented as much as possible with available information. This is about how to use and when to use the unspecified codes. Now, what not to do with the unspecified code? So you should not, don't choose a specific code unless and until it is clearly supported by the medical record. So you should not do the extra or unnecessary test. So just to make the code more specific. If the diagnosis isn't clear, just code what is known or what are the symptoms, what are the signs are provided in the document. Accuracy and honesty in documentation are more important than guessing a code. You should never assign a code with guessing. You always code with the clear diagnosis and with the clear confirmation from the provider. And next, coding for healthcare encounters in hurricane aftermath. So what is the use of external cause of morbidity codes? So whenever someone is injured because of a hurricane, so we must use external cause of morbidity codes to show how the injury happened. So what does these codes do? These codes are extra codes which are used in addition to the regular ICD-10 diagnosis codes. Right. So what are the key points you have to remember over here? So these codes identify the cause of injury. So what are the examples of cause of injury? They may be debris, flooding, collapse, etc. So they are not used as a main diagnosis. The injury itself should be coded first. For example, if a person has a leg fracture caused by a hurricane, so you have to code first the fracture, right? Because it's the main cause for the visit or encounter. So then you have to add the external cause code. So what is the reason for the hurricane? So this must be the secondary code. So what does these codes capture? They explain the details of the event such as cause, means how the injury happened. So was it accidental or intentional? Where it has occurred? Nothing but the place of occurrence. And what activity was the person doing when it was happened? And also the person's status, whether he is a civilian, whether he is a military or etc. So you should not use these codes for people who were affected by the hurricane but didn't get injured or poisoned. So someone who came for stress or asthma checkup after the hurricane. So these codes are not used. Right. They are only used during a fractures or collapse or flooding. So external cause codes always tells the story of how an injury happened, but not what the injury is. Right. So they help to make the record more complete and useful for data and safety purposes. So these codes are used for every visit whenever a person is treated for an injury caused by the hurricane. So this can be used in any healthcare setting like hospital, clinic or any place where a licensed healthcare provider gives care. So what does this codes help? So they helps to collect the accurate ICD-10 data about the hurricane's effects on the health. So for example, if a person is injured by flying debris during a hurricane, so what we do? We record the both, right? One code is for injury, like what is the fracture or what is the cut, and the other code is external cause code to show it was caused by the hurricane. So next, the sequencing. So how to arrange in the sequencing order. So how to assign in a sequencing of the external causes. So there are codes for major natural disasters. So they should be listed first before any other cause of the injury codes. So the only exceptions that take higher priority are child abuse, adult abuse, and terrorism. So you can use more than one external cause code if needed to explain everything about how the injury happened. So what you have learned from this slide? You should always use the external cause codes for hurricane related injuries. This hurricane, it codes come first except in the cases of abuse or terrorism. Use as many as codes as needed to tell the full story of the injury. For example, a building collapsed during hurricane. If someone is injured because a building collapsed, you must assign two external cause codes. So one for hurricane and another for the building collapse. So the hurricane code, it should always comes first. So the other example, injuries directly caused by the hurricane. So first use the injury code, for example, fracture, cut, or etc. Then you have to code for the hurricane to show whether it's the initial encounter, subsequent, or sequel. It's nothing but a seventh character. So after that, add any other related external codes if needed. Taking another example, flooding related injuries. So X37.0, we will assign this code for whenever a flooding is caused by the breaking due to hurricane. So X38 is for flood, when the injury is caused by flooding directly from the storm itself. So here, this hurricane is the main event, and the building collapse, the flood due to the hurricane, and also flood directly for storm. These are all the secondary external cause codes. So here you have a code X36.0. This is collapse of a dam or a man-made structure. So you should not use this X36.0 whenever the collapse was caused by a hurricane. This code is only used for the collapses caused by the earth movements. So whenever it was caused by the natural processes, you should not use for those caused by storm surges or hurricane winds. So what are the other external causes of morbidity codes issues? So whenever injury is not a direct result of the hurricane. For example, a person evacuating from the hurricane is injured in a car accident. So what codes you have to assign over here? You have to use codes for the car accident, but you should not use X37.0 because the hurricane, it did not directly cause the injury. So when it's unclear if the injury is from the hurricane, if documentation doesn't clearly state the cause, you have to assume the injury is due to hurricane. In that case, you have to use X37.0 along with any other relevant external cause codes. So this is about the morbidity code issues and the external cause codes. So the next, coming to the last guideline, use of Z codes. So what are Z codes? So Z codes are used when a person comes from healthcare for reasons other than a disease or injury. So they help to explain why the patient is receiving care. For example, follow-up visits, transfers between facilities, and also the social problems affecting health. So when to use these Z codes? They can be used as a principal diagnosis when the main reason for visit, and it can be used as secondary diagnosis whenever additional information must be needed, or you can use as both depending on the situation. So what is the ICD 10 guideline for Z codes? This guidelines explain which Z codes can be first listed only, secondary only, or used in either position. So there are some examples of applicable Z codes. So what are those? Z59.0, it is homelessness. And Z59.1, inadequate housing. Z59.5, extreme poverty. Z75.1, so person awaiting admission to adequate facility elsewhere. So Z75.3, unavailability and inaccessibility of healthcare facilities. So in simple words, Z codes are used to show social or environmental reasons that affect a patient's health or medical records. So these external cause codes for injuries or disasters and the Z codes for reasons for healthcare encounters, these are given here not as a complete list. So this coder should choose any additional codes that apply. So depending upon the documentation in the patient's record. So you have to assign as many as codes needed to describe the patient situation. These Z codes, they help to describe non-medical or situational reasons for healthcare visits. Coders should always use all the relevant codes to explain why the patient came for care, especially when information is limited during emergencies or disasters. So the thing is, you can assign as many as codes needed to describe the patient situation fully. This is mainly about the external codes and the Z codes. So this is all about today's session. In the next session, you are going to learn about the CPT guidelines. And that's it for today. Thank you.